All right. Welcome, everybody. We're about to go live. We're going to give it a minute for everybody to join on. Hope everyone's doing well. Okay. We're doing our usual Wednesday afternoon lives. Hope everyone's doing well. We'll give it a minute for everybody to join on. I am on YouTube, Instagram, and TikTok. So welcome to our weekly live. My name is Dr. Roger Tsai. I'm a board certified plastic surgeon. I'm in Los Angeles, California by Beverly Hills, West Hollywood area. Christina, miss you too. Oh, thanks. Doing something a little different. How are you? Did you move? I think I've been following you a little bit. But I hope you're doing well and wishing the best for you. Mr. Langlos, I have a question. Yes, go ahead. Sorry, I'm gonna give it a minute for everybody to join. All right, so before we get the questions moving, please check out the link tree above. It's got my links to all my social media platforms, my regular Instagram, my before and after Instagram, my TikTok, YouTube, got a lot of educational information on there. Definitely check those out if you're interested in learning more. You can also book a consultation right into my schedule there. Yeah, there you go. Can too many nose jobs make your nose sensible to allergies? No, that too many nose jobs is gonna have more scar tissue and swelling every time you do it, but it's not gonna have any issues with allergies. It's just like, if you're allergic to peanuts, you're always gonna be allergic to peanuts, right? Regardless of, whatever surgery you're going under. So same thing if you have allergies to pollen or cat dander or dog, it's not gonna change what you're necessarily allergic to or cause more sensitivity. It's just kind of how your body is. Can I have surgery for face fat at 17? Yes, you can, as long as you get signed off by your parents. You have to be 18 and above to sign off on your own. But if you have an adult or your parents or your guardian sign off for you to have surgery, yes, you can absolutely get facial surgery at 17. Hi, Honey Jones. Thanks for joining. Good to see you. All right. Yes, in Arizona now. Oh, nice. Hope you're enjoying it out there. That's wonderful. I hope you're, like I said, Arizona's treating you well. All right. All right. Let's give it another minute for everybody to join up. Okay, great. So, what is a mommy makeover? So, a mommy makeover is basically a breast and body procedure. It's not necessarily, it's more of a generalized term for basically getting the body back to where it used to be. So, the breasts, sometimes all you need is a breast augmentation. For example, today we saw a patient, mommy makeover. All she needed was a breast augmentation. Didn't need a breast lift, little tummy tuck, and some liposuction. So that's all she needed. But some patients will need a breast lift, right? And some patients may not even need a tummy tuck, or some patients who are very thin might not even need liposuction. So it's very different for each patient, and we customize it for each patient. Martinique. Oh, Shania Salayana. Welcome for joining. Thanks for joining. Welcome. Is it true if you get sculpture in your face, you can never get a facelift? No, that's not true. You can get sculpture, you can get threads, you can do all that stuff, skin tightening, all that stuff, and still get a facelift afterwards. So no, that's not true. Do plastic surgeons perform chin implants to someone with a big overbite, or does bite need? So yes, we can perform chin implant to something with an overbite. That's fine, but if you need dental work done, that needs to be done first before you do the chin implant. So you have to talk to your oral surgeon or a dentist to see exactly what you need to do to get the bite right, because you got to eat, right? You want a good bite. And so once they can figure that out, then you can figure out the chin implant situation. Is it true that fillers can go to spread anywhere on your face because you look a little weird? It might spread, but it doesn't spread that far. I mean, maybe a millimeter or two. It's not like it's going to go from here all of a sudden here, or if you have cheek fillers, it's going to go down here. It doesn't travel that far. So only like a couple of millimeters or so. Correction first. Do plastic surgeons need someone with a big, or does bite need a big? Yeah, so I answered that. Yeah, you might want to fix the correction first. Doctor, can you take semaglutide if you had a BBL? You can absolutely take it, sure. You just do realize that when you lose weight and when you lose fat, the BBL can shrink down as well. So as long as you understand that, yeah, absolutely you can. Hello from Florida on a GLP-1. Once I get to my goal weight, do you suggest breast, tummy tuck all at once? Absolutely. I think, again, that's the basis of a mommy makeover, right? You do the breasts and the tummy at the same time, as I was mentioning about a couple of minutes ago. So I saw a patient earlier this morning that wanted the breast and a tummy tuck at the same time. I feel like those combo cases, you're really going to see an exponential change, not just an additive, but more of a multiplicative change when you do the breast and the body at the same time. You're going to look amazing. Otherwise, you have to do 2 different surgeries, have anesthesia twice, and recover twice. And it's best to do it all at one time if you can. Sorry, Bear. I'm not sure what you mean by that, but hello, Brooke. Thanks for joining. Where's the next question? Sorry, Bear. Where are you located? I'm in Los Angeles, California, basically West Hollywood, Beverly Hills. Thank you. My pleasure. How do you fix hypertrophic scars? You can either put steroids in them or you can cut them out. Day. Nice. Thank you. My pleasure. Thoughts on cheek implants? I don't do cheek implants. I think there's issues with them. I probably wouldn't do it. I'd probably stick with more fillers or fat grafting. Fat grafting is going to be more permanent. You can put a lot of volume in there. So I think fat grafting is the best for that. What would be the best procedure for nasolabial folds around the mouth? If it's very mild, maybe some fillers or threads. If it's more significant, you're going to need more of a facelift type procedure. How long is the recovery? Recovery for what, Juju? I have a big tummy hangover that causes issues. C-section 33 years ago, gallbladder out, hysterectomy. You're probably going to need a tummy tuck or some kind of a liposuction and tummy tuck at the same time. How many hours does the average tummy tuck take? Tummy tuck by itself, 2 hours. If you add lipo, probably 2 to 3 hours. Got a neck lift. I'm afraid I was told no ice to the area post-op. Do you agree? Did you get fat grafting? It depends. If you got fat grafting, then no icing. But if you didn't get fat grafting, you can ice. So I'm not sure why they said that. Hi, good live. Oh, thank you, Dr. Labraska. Thanks for joining. Appreciate it. You do gyno for men? Absolutely, yes. I do a lot of gyno for men. Again, click that link above. You can set up a consultation with me. There's different types of gyno that we can fix, whether it's just volume, breast tissue, or skin. So there's like the different levels when it comes to the gyno. Hi, should I get masseter Botox or get a chin implant or after, or it doesn't matter? It doesn't matter. You can get masseter. So the masseter Botox and chin implants are 2 totally separate things. The masseter Botox basically shrinks down the volume that when you bite down that muscle there, it shrinks down just a little bit, so you get more of a contour there. Whereas a chin implant is going to give you more length or width to the chin. You can do both of them at the same time, or you can do it separately, and you can do one or the other first. It really doesn't matter the order for that either. Hi there, can plastic surgeon step up belly ring hole? Yeah, absolutely, we can. Fresh Corn Grill is so good. Yeah, I love Fresh Corn Grill. It's one of my favorite places. I did an arm lift 3 months ago and the scars look so dark. Does scar tape help this late or other options? I would do scar tape now, absolutely. I mean, up to a year you can use the silicone scar tape. Just make sure it has silicone in there. That's the most important thing. Ozempic face, 47-year-old. Do I need a neck lift for the loose skin? Yes, you most likely will. Thoughts on hair transplant? Which one's the best? FUE, the follicular unit extraction, where they take one hair graft at a time and put it on the front. That's the best to do. Can't wait to get my breast done by you in a couple of months. All right, Jordan, can't wait as well. Good to see you. Let us know if there's anything else we can help as you go along through this process, but look forward to it. What do you think of reverse tummy tuck? I don't think there's anything wrong with it. Just understand there's limitations with it. So basically, you are pulling, for those of you who don't know what that means, a reverse tummy tuck means the scar is right here and you pull upwards instead of pulling downwards. Now, pulling upwards is fine. Just understand you're going to have a big old scar that goes underneath kind of the breast tissue, and also do understand that it only takes care of the loose skin above the belly button. Loose skin below the belly button, it will not take care of that whatsoever. All right, a lot of questions coming in, so we'll try to get through these a little quicker. Where am I at? Do you do rhinoplasties? I do a ton of rhinoplasties. That's probably like my #1 procedure by volume. If you click on my link tree above and look at the before and after Instagram page, you'll see all the rhinoplasties that I've done. Upper left scar on brown or lid crease. It's on the lid crease, so you're never going to see it. Lost 85 pounds on Zepbound. I hate my loose skin on the chin. Will Nefertiti help? No. If you have loose skin, the Nefertiti is basically Botox that helps elevate it just a little bit by relaxing the muscles. That's for very, very, very mild issues. If you have loose skin to the point where you have a decent amount, it's not going to help. You're going to need some kind of lift. I'm scared to take semaglutide. Hey, Doc. Hi, Diamond. Good to see you. I'm scared to take semaglutide because of dehydration. I have IC already, so I struggle. It's not going to cause dehydration. You're probably just going to drink enough. I mean, when you're not eating, you're probably not drinking enough either. That's the issue. So just make sure you drink enough liquids. Recovery for gyno is very small. It's not very tough at all, absolutely. You just can't go work out for a couple of weeks. So the recovery itself isn't bad at all. You just have to take some time off the gym. That's about it. Do you do any cleft lip chin surgery? I don't, unfortunately. That's going to be more of a reconstructive person. I have severe migraines. What should I do? It burns like crazy. I wouldn't be able to help you with migraines. I'm a plastic surgeon. You're going to have to see more of a neurologist for that. Doc, please look into selenus derma PRP and let me know if it's safe and good to do, please. Diamond, DM me. Do me a favor because I have a lot of, I might forget. So Diamond, please send me a DM and I'll look into that for you. What about early age jowls? So I actually had a consult this morning on a 40-something-year-old. She already has jowls. She's talking about a facelift. Long story short, you're probably going to need a facelift. Is a nose job a long recovery? Not really. You know, you have a cast on for a week. I tell patients you're not going to be presentable for about a month, which means that, you know, if you want to go to a wedding or an event, you're probably going to give you about a month, but swelling can last 6 to 12 months. So it can take some time for it to fully go down, but you only look funny for about a month. I'm scared to take some semaglutide. I already talked about that. What about early age gels? I'm 39. Same thing. You know, I as I mentioned, I just had a consult with a 40-year-old about it. What do you think? What do you do if you have gastric sleeve and you have skin hanging, but you can't get a tummy tuck yet? Why wouldn't you be able to get a tummy tuck? Because you're still losing weight. There's not much you can do. The only way to remove skin is to get a tummy tuck. So I would wait until you can't get the tummy tuck and then get the tummy tuck. Love your work. Letting get my nose done with you. What's the average price of rhinoplasty with you? Primary rhinoplasty starts at $15,000 HSXO. So again, click that link above, or actually since you're on Instagram, you can already see my work there. Or send me a DM or click the link above and schedule a consult with me and we'll get you on the schedule. What are your opinions on Jeuveau? So I don't, you know, Jeuveau's, it's fine. It's probably more like third tiered. So you got Botox, Dysport, and then probably Jeuveau or Daxxify is probably on the same level there. I don't know too much about it. I tried it when it first came out and it's supposed to last longer or be stronger, but it really didn't do that. And so, you know, it's more about pricing. You know, I don't know if Jeuveau is more expensive or not, but I think they're all pretty much very similar, but I think Botox is still number one, Dysport's number two, and I think Jeuveau and Daxxify are probably number three, and then you have Xeomin, which I think is definitely more in the fourth place of things. So, hope that helps, Christina. All right. I got my muscle implants, BA. How long do they take to drop on weekly post? It's going to take 3 to 6 months to drop. Thoughts on Softwave, worth it? I don't know much about that, unfortunately. So you'd have to go see, I don't do non-invasive stuff. Wow, okay. Got a lot of questions. I'm gonna go a little quicker here because I have a lot of questions to go through. Do you do any cleft chin surgery? I don't. What about early age jowls? I'm 39. Again, you need a facelift. How much would a plastic surgeon charge for sticking the belly breathing hole? Probably about $1,000. Thank you, my pleasure. Is mini facelift the only option to fix sagging jowls? That's the only way. You need a facelift, yes. Hi, hello, Vivian. Good to see you. Juju, what does it mean when you have to do muscle repair? That basically means when you do a tummy tuck, the muscle repair tightens that muscle, so it doesn't kind of bulge out. Why do some say I have eye bags, other days I don't have them? Swelling. Everybody swells differently. Did you eat more salt that day? You know, what kind of foods have you been eating? Things like that. I'm scared. Okay, talked about that. Why do some say I have? Okay, talked about that. Ozempic after deep plane facelift. How can I keep the face volume that I now have? Make sure you eat a lot of protein. Make sure, and you know, it's hard because when you do Ozempic, you're going to lose weight and lose volume as well, right? Because when you lose weight, you lose volume. When you lose weight and lose volume, there's going to be a skin issue. So I would say don't do Ozempic. I mean, you probably should have done the Ozempic first. You always want to do volume and then skin. So you kind of, unfortunately, didn't do it in the correct sequence. Can liposuction be done on anyone? Basically, yeah. Why do some say I have? Okay, answered that. I answered that. No fat under the eyes, but hollow. What do you suggest? Probably fillers or fat grafting. What's the cost of leg skin removal or thighs, give or take? 20 grand. Hey doc, I already answered that. Thigh lifts. What about them? Why do some say? Okay, answered that. I've had my implants for 20 years. If you don't have any issues after 20 years, I think you know, you're fine. 20, 30 years, keep them in as long as you feel like you're not having issues with them. I need lipo 360. Great. Hit me up in the comments, or sorry, hit me up in the link above to schedule a consult, or DM me and I can get my coordinator to get you scheduled for a consult. Lasers I don't know much about, so I'm going to skip that. Silicone or saline gummy bears with lift, about B size and what I had before kids. Silicone gummy bear is the best out there. Is Avelli effective and permanent? I have cellulite on my thighs. It's effective and permanent, but it's not 100% either. It helps soften it, but it's not 100%. How long till above the muscle B starts to drop? I've already talked about that. About 3 to 6 months. I know you're not a dermatologist, but any sunscreen you really like? I'm visiting Galveston for Girls Weekend, and we're cooking on the beach. Oh, nice. Honestly, I don't think there's a best one out there. I personally use, I think it's called Skin Better. There's stuff by, there's not really one that I think is best or not the best. I've actually tried them all, and they're all pretty much the same. I just kind of, whatever we have in the office, I just use. So as long as it's like a medical grade one, you know, and it's a mineral sunscreen, make sure you use a mineral sunscreen. So it's got to be like, look at the back, make sure it's not chemicals, make sure it has like metal in there, like zinc oxide or, you know, whatever else they use. So make sure there's some metal in there. Those are the best sunscreens. Other than that, I think as far as brand goes, I don't think it really makes a difference. All right, so sorry. Okay, so I just had 60 questions that popped through. So I'm just gonna, it's a very robust one today. So I'm just gonna answer the ones that come up the latest, because those people are probably still here. I'm not sure if 60 questions ago those are probably still here. So I'm gonna just ask the latest ones. If I miss your question, I apologize. I just have a lot coming in, so just keep asking and I'll get to it. Okay. I love your lives. Please don't stop doing them. I won't stop doing them. I think these are great for me as well. I love teaching and I love getting the information out. So no plans on stopping anytime soon. Doc, should I volunteer at homeless shelter as a pre-med? No. I mean, volunteer in something in science or in medicine. Don't do something that's outside of the realm of medicine. You want to do volunteer within the realm of medicine if you want to go into medicine. I had implant exchange in Capsular fee. When can I sleep on the side? 700 ultra high. Oh, amazing. Great. I usually don't have my patients sleep on the side until about 2 or 3 weeks. Very informative. Thank you. My pleasure. What does it mean if you're laying down and it hurts your stomach to sneeze? Did you have surgery? If you didn't have surgery, I would go see a GI doctor about that. I'm not sure why you would have that. Do you think AI will pose a risk to certain specialties like radiology? I still think you're going to need a human eye to look at things. As far as medicine goes, I think we're pretty safe with AI because you need somebody to actually, you know, do the procedures and so on. Wow, you're gorgeous. Oh, thank you very much, Visas. I appreciate that. Uneven arms, what options? Liposuction or arm lift? How long after C-section can I get a tummy tuck? I would say 6 months after you're weight stable. So after pregnancy, sometimes it takes 6 months, 8 months, 10 months to be weight stable. Add 6 months on top of that, and you can get your tummy tuck. Can you make calves smaller? You can. I don't personally do them, but I know of a doctor in town that they go in and basically pull out some of the muscle. So it can be done, but I don't do those. Do you perform rhinoplasty? I do a ton of rhinoplasties. Again, if you click on the link above and look at my before and after page, I think rhinoplasties are probably, between rhinoplasties and breast augmentations, those are my top 2 procedures by volume. I have 3 kids, one of them, which is one. When do you suggest a rhinoplasty? You can get it now. You can get it now. Body procedures, you want to get your body to a weight stable weight, I guess, long story short. When it comes to rhinoplasties, it doesn't matter because there's kind of no fat in the nose. So if you're interested in rhinoplasty, you can get it now. You can get it done now, Megan. Again, click that link tree above and schedule a consult with me if you would like to have a consultation and chat. Thoughts on face tight? I don't do them, but anything that you depend on your body to tighten up is going to be very hit or miss. Can you make your calves larger? Work out. But you can do fat grafting. You can do, you know, BBL, fat transfer the calves. So technically, yes. 230 pounds was the best thing, the sleeve or mommy makeover? You're gonna need a sleeve first. You need to lose weight. 230 is a bit heavy to do mommy makeover. Your BMI or your body mass index needs to be around 30, which is your height and weight ratio. So you can't even get a mommy makeover at the moment. You need to get the sleeve first, lose the weight, and then do the mommy makeover. I think AI will help diagnostic side of medical world like tests and such. I agree. I think for diagnostic, you're absolutely correct. The diagnostic side of things, like lab values and things like that, you know, diabetes, you know, things that exactly diagnostic side would help. Anything, again, on the surgical end of things, you still probably need a human to be doing. Can breast reduction scars be fixed? Discoloration, junction? Yes, you can do scar cream therapy. You can do steroids. You can actually do a scar revision and cut it out and redo it. Really good answer. Work out. Yeah, work out. But again, sometimes I get it's tough for some patients, but you can do fat grafting, lipo the stomach, and do fat transfer to the calves. If ever, how often have you experienced people suffering from implant illness? Me personally, I have yet to have one patient, and I've done over 1,000 of these, that have patients that have had breast implant illness. Now, I've had patients come see me because they've had breast implant illness. So I've taken care of a handful of patients that seem to have breast implant illness, but none of my patients that I've put implants in have yet to have breast implant illness. So very rare. I think it's 1 in 3,000 to 1 in 30,000. So is there a surgery for heartburn? There is, but you got to go see a GI doctor for that. They help tighten the sphincter. I would prefer a human to look at me, and the computer just confirms. Absolutely, I agree. I think, at least as far as medicine goes, the computer can help definitely verify some things, but you still need a human to really look and examine things, because medicine isn't an exact science, right? It's not like 1 + 1 is 2. You know, body's different, anatomy is different. There's so many variables within the human, from one human to the next, that it's hard for like a more objective measure like AI to figure things out. What was the answer? Do some body types, anatomy, skin elasticity more prone to implants not holding up upper pole fullness? Absolutely. So if you've been following me, patients who go very large with implants, or patients who have had multiple children and the skin envelope isn't quite there, it's not going to hold the implant quite as well. So last Friday, I did a patient that wanted to go a little bit larger. She had 3 children, and her skin envelope kind of wasn't there. So I put an internal bra to help support that bottom part. It's almost like a hammock inside the breast to help support it so that it doesn't fall quite as much. So yes, you're absolutely correct. The skin envelope can have a factor into it, but there's also ways that we can do to reinforce that skin envelope to make it stronger as well. Hi, Dr. Hi, Sierra. Good to see you. How are you? Are you hiring for surgical techs? Not at the moment. Can a 360 tummy tuck be done after doing a regular tummy tuck? Absolutely, yeah. If you click on my link above, that link tree above, if you click on my before and after page, you can see I've done a lot of tummy tucks and 360 at the same time. Basically, what you're seeing is a revision tummy tuck, but long story short, yes, you can still do that. New here, where are you located? I'm in Los Angeles, California, between West Hollywood and Beverly Hills. I'm in West Hollywood, basically, but on the edge of West Hollywood, Beverly Hills, I mean. How often should you replace your implant? Very good question, Victoria. So my take on it is, if there's no issues with them, no rupture of the implant, no capsular contracture, it doesn't sag, it looks fine, you're not having any issues with it, leave them alone until you do have issues with them. So keep it in, you can keep it in 20, 30, 40, 50 years. I mean, if not have any problems with them, just let it be. How do fat transplants do after implant removal? I think they're great. For the breast, you're only looking about a cup and a half. So do realize that it's not going to be quite as robust as a breast implant. Also, a breast implant is going to give you more support. So it's not going to, unfortunately, get you the same look or appearance, but you don't have to deal with an implant, capsular contracture, breast implants, leaking, or having to have another surgery at the end of the day. Anything you look for when hiring a receptionist? I think of switching to doctor's offices instead of a hospital. Basically, I don't know what just happened here. Why am I black and I don't know what just happened on Instagram, but I'm black and white here. I don't know how to change that, so I guess you're stuck with me for black and white for a minute. But basically, we're looking for basically how interested you are in your work ethic. Long story short, I really don't know what happened here. I don't know if I pressed the filter or something, but anyways. Well, you're gonna see me black and white over here for a minute. I went from 215 to 175, slow weight loss process. Can I get a tummy tuck now, or should I wait to try to lose more? It's up to you. I would say wait until you're at the bottom of your weight loss journey, and then do your tummy tuck. So if you're at 175 and you feel like you can't lose any more weight, then you can do it now. But if you feel like you lose a little bit more, I would continue doing that. Do you prefer saline or silicone implants? Highly prefer silicone implants. Highly. Where can we call for a consultation with you? So Maricela, a couple ways. You can click on my profile above. There's a link tree there. You can schedule a consultation right into my schedule right away. Put your name, information, and all that, and you'll get right into my schedule. Find the time. You can also DM me. You can also go on my profile. There's my phone number on there. There's my address on there. You can call and get a consultation with me. So a couple of different ways, but I think the easiest one is, again, click the link tree in my profile. Click on the link that says schedule a consult now, and you can actually find a time to do a consult with me right away. It's normal here. Yeah, this is TikTok. Sorry, I'm on TikTok and Instagram and YouTube. So Instagram is the one that has a filter for some reason. But yeah, my TikTok is working fine. I don't know if I was pressing stuff to look at questions or not. But filter will attract more people. Yeah, hopefully. Do Do you do 360 lipo? Yes, I do a ton of 360 lipos. Amelia, again, click that link above. Look at my before and after Instagram page, and you'll see all the 360s that I've done. Why silicone? I think silicone's softer, more natural looking, more natural appearing, especially nowadays, patients coming in wanting to be more natural looking, more natural appearing. Saline implant tends to ripple a lot more. It's more exotic looking, and it doesn't feel quite as natural as a silicone implant. Will Ozempic be effective for weight loss if it's used after using Mounjaro? I think Mounjaro tends to be more effective than Ozempic. I think it's the other way around. So if you do Ozempic and then do Mounjaro after, it'd be more effective. Hi, Bale here. Hey, thanks for Brazil here. Hey, thanks for joining from Brazil. Thanks for joining, Claudio. Good to see you. I like a tummy tuck. Told I was too heavy to get to surgery. Well, your BMI needs to be 30 or below. Okay, so you can go online, type in BMI, body mass index calculator, put in your height, put in your weight, and see where you're at. If you're above 30, yes, you're too heavy. You need to be 30 and below because there's a high risk of surgical complications. Mounjaro is the best of four. I agree. I think Mounjaro is the best of four. There's less side effects, and I feel like it helps with more efficient in the weight loss journey for patients. Should I wait until I'm done having kids for a mommy makeover? Yes, I think you should be done because you don't want to do the mommy makeover and then have the skin stretched out again and then having to do another mommy makeover, right? You kind of want to do one surgery and be done with it. So that's what I would recommend, yes. How do you avoid a hematoma? Nothing you can do. That's basically just one of those things that potentially can happen. Can you ever get surgery if your hemoglobin does not get to a level it needs to be? No, your hemoglobin needs to be at the right level, especially with cosmetic surgery. We'll cancel the surgery or delay the surgery until your hemoglobin is correct. What is the recovery for breast implants? 1 week, it's basically for a month, you're not doing any heavy lifting or soaking. So 1 week, you're back to doing normal routine activities, no heavy lifting. 1 month to basically get back to lifting in the gym. 30 and below, absolutely correct. What do you think about severe hidradenitis suppurativa correction between the legs and armpits? I don't think there's anything wrong with that. It's a very hard surgery for the patients, not from the surgeon, but a very hard surgery for the patients to undergo because they got to cut out all the skin and all the sweat glands and then either skin graft them or do flaps. So it's a tough surgery to recover from, but if it's bothering you enough to where it smells or you're having rashes and you just can't go out, then it's probably worth doing. Hi, Catherine. I'm 5'9", 130 pounds with base diameter of 11. Do you think 5'30" would be too small on my height? No, not necessarily. I mean, I think as far as volume goes, we can go put a big one, we can put a small one. What we got to do is make sure the base diameter of 11 fits. So if you do, like let's say, a high profile implant, you could probably go in the 400s. If we do a low profile implant, we probably have to stick in the 200s. So it really also depends on the profile that we do. But I think 350 is fine. I mean, I think my most common size is 350 to 375. That's my most common, as far as volume goes, what most patients pick. If they're like an A, they want to be like a big C, that's probably the most common size. So no, I don't think it's too small. I think you're fine. I think, again, Catherine, I do things differently. If you're in LA, if you want to come see me, I'd be more than happy to do the way I do sizing for patients. I think I do it a way that I don't think anybody in town does it because it is time consuming, but I don't mind spending time with my patients. I mean, I'm doing a live outside of my time to talk to you guys about this kind of stuff. So, I'd rather patients know exactly what they're getting themselves into, but I literally have patients try on implants. I have a ton of implants they try on. You look at the mirror and you tell me what you like. So that's how I do sizing. As long as you know what you like, basically I can help you from there. I will definitely reach out for a consult. Thank you. My pleasure, Catherine. So again, a couple ways to do a consultation. Click my link tree in my profile. Click you can click the consultation schedule right into my schedule, or you can send me a direct message. I'll have my office reach out and or call my office. All my information is on the profile as well. I want to opposite a reduction. Yeah, it happens. I do a lot of reductions as well. Sometimes they're heavy, they're pendulous, they weigh on your shoulders, your neck. Sometimes you have neck, back pain. And so reduction's amazing because it does two things. There's a functional aspect to it and there's an aesthetic aspect to it. So from a functional standpoint, you can work out, you have range of motion, you feel great. In an aesthetic aspect, obviously, you're not quite so big or quite so heavy. Do you do block removal? Are you talking about capsule, like a capsulectomy? Yes, if that's what you're talking about, yes. Can you get a reaction this late after 8 years? Capsular contracture? Yes. Do you do corrective surgery on capsular contractures? Yeah, I do it all the time, unfortunately. So yeah, you got to take the capsule. Since you're on TikTok, you maybe have to scroll 2 or 3 years back, but I did a couple of videos on capsules, so I might repost it just to get it to the top of the page. But yes, I do. I got referral to a plastic surgeon plastics doctor that's on probation with the board, should I run? I mean, I guess it depends on what the issue is. I'm not sure. You know, probation, again, it depends on what the issue is. I would say talk to the doctor, see what the reason is for it, and then take it from there. That doesn't necessarily mean they're bad. There's nothing wrong with it. I mean, if you got a license that's revoked, that's different. That's a totally different thing. Probation, just a slap on the wrist. OTM implant, I have a full post-surgery. I was told to massage. It has not. Over the muscle implants, I have a full post-surgery. I don't know what to tell you. I can't really speak on specific issues because I'd have to examine you and do a whole thing. So you'd have to talk to your surgeon about that. I really couldn't tell you. How likely is a capsular contracture to happen? I would say in my office, less than 5%. In the literature, it's about 10 to 15%. I do, again, a couple different things. I use a funnel, a brand new funnel, by the way, not a reused funnel. I changed my gloves out. Anti-triple antibiotic solution into the pocket. 90 days of Singular. And I start aggressive breast massages fairly early on. So symptoms of capsular contracture: feels tight, and there's a displacement. Usually one's a little bit higher and it feels tight. That's basically the two things you have. I can't wait to go to you. Do you think I should wait until I'm 30? 25 feels too soon. For what lifetime story? Like what type of surgery are you looking to do? I personally feel whether you're young or old, you know, if you're, you know, in your teens or early 20s, or even if you're 70, 80. I mean, I just saw today a 70-year-old for a mommy makeover. Age is just a number. If you're healthy for surgery and your issues gonna make sense, you know, and it's bothering you, then absolutely you can have surgery. I think, you know, there's nothing wrong with age. Breast, you can do it now. I mean, why wait till 30? Enjoy them now while you can, right? You're probably young, you want to travel and see the world. Why not do it now, right? So again, lifetime story, hit me up in the DM or click that link above and schedule a consultation with me, and I'd be more than happy to chat with you some more. Are textured plant implants legal? They're technically legal, but you know, Allergan has recalled them because there is a link with textured implants and what we call ALCL, which is a type of, BIA-ALCL, which is a type of breast implant associated large cell lymphoma. Is fat grafting successful after explant? Yeah, it absolutely is. Do you understand fat grafting? You know, a lot of the fat doesn't survive, about 40%, and then 20 to 40% of the fat doesn't survive. So yes, it works well, but also do understand there's limitations with it as well. Is it safe to get lift augmentation after liver transplant? You can, as long as you have a clearance from your medical doctor saying that you're safe to undergo, you know, general anesthesia and surgery. Sure. Is there any chance of treatment I can get rid of ice pick scars? I have. You'd have to go see a dermatologist. You know, there's one in my building that does a lot of those that I can refer you to. His name is Dr. Jason Emmer. He does a lot of the ice pick scars, so I would go see him. He seems to get very good results on that as well. But that's more of a dermatology thing. My silicone implants are almost 9 years old, super sore with redness thoughts. Probably go get an MRI to see if there's rupture, if there's any issues with them. And then after that, go see a plastic surgeon to see kind of what's going on. That's what I would do. Power mode, okay. What do you offer for turkey neck? You're gonna need to, probably gonna need to have a neck lift. Dr. Handsome. Oh, thank you. Appreciate that. Is fat grafting? Okay, answered that. What's the difference between mommy makeover and tummy tuck? So, a mommy makeover is basically a procedure that rejuvenates the breast and the stomach area or the body to get you to a pre-pregnancy state. A tummy tuck only takes care of the extra skin on the tummy. So mommy makeover could be a breast dog with a breast lift, with a tummy tuck, with liposuction, BBL, all those types of things. But a tummy tuck only takes care of the loose skin on the belly. Why do you have to stop smoking to get surgery mommy makeover? So the reason you have to stop smoking is because one cigarette will stop blood flow to the capillaries at the top of the skin for 45 minutes, okay? If you have a fresh incision and blood's not going there to heal, guess what happens? You're not gonna heal very well. If the incisions open up, you can get an infection and it can go deep into your body. So smoking is an absolute no. In fact, a lot of places will test your urine before surgery, and if you have nicotine there, you'll cancel the surgery. It's that bad, okay? Trust me, I've seen, you know, wounds and stuff from patients who smoke. Like when I used to work in the hospital, we had to do emergency procedures, and if you smoke or not smoke, you still have to do surgery, and their wounds don't heal very well, and they're in the ICU because it opened up, especially for like heart attacks. You know, your wound opens up, now you got this huge gaping wound there. You have to put and now you're in the ICU, intubated, and all this kind of stuff until it heals. So no, it's a terrible thing to do before surgery. Did you go to medical school in the U.S.? I did. I went to Drexel University in Philadelphia. What do you think about implants after radiation? That's more reconstruction. I don't really know much about that. You're gonna have to talk to more of a reconstructive surgeon for that. Lemon turmeric acid bar for face, just saw that. I don't know. Those are more. I wouldn't be able to talk to you about that because that's not like in the medical field. I guess that's more, outside of my expertise. Philly, yep, was in Philly for a few years. What 12 areas are lipo? 12 areas. I don't know about 12 areas of lipo 360. Everybody does areas differently. I'm not sure why they do areas. I consider lipo 360 stomach, flanks, upper, lower back. Just basically everything from here to your groin except the chest. That's why I think lipo 360. I don't really count areas. Dog keeps his face perfect. I try. I have access to good stuff here. Do all thigh lifts have a wide incision? Not all thigh lifts. Most of them do, but not all thigh lifts. You can get a mini thigh lift incision that's just in the groin crease. What is your expertise? I do a little bit of everything, but my major procedures are facelifts, rhinoplasties and breast augmentations. And those are also my favorite procedures to perform. Where are you located? I'm in Los Angeles, California. If I got over the muscle implants, why do I have to wait 4 weeks to work out even lower body? Because you don't want all the inflammation in the chest, because the biggest complication that comes from breast implants is something called capsular contracture. Capsular contracture happens because there's too much scar tissue formation, so anything that's going to cause scar tissue formation to be overwhelmed, you want to not do. So yes, because of scar tissue formation. Share the secret. I'm 37 and you look younger than me. Peptides, NAD. I've been doing a lot of regenerative. I'm looking into more regenerative medicine type of thing. So NAD, I do that probably once a month at the moment. NAD IV, that is. I just started getting back on my peptides. BPC 157, CJC, ipamorelin, copper peptide. I'm kind of getting back into the cycle of things. So that's what I do. Skincare as well. How often do you replace your implants? You don't have to replace them unless there's an issue with them. So I personally feel like if it's 20, 30, 40, 50 years, so be it. Unless it's ruptured, unless you have a capsular contracture, unless it's sagging to the point where you don't like them anymore, then I would just keep them in until you have a problem with them. What happens if an implant pops? Just replace them. What is your skincare routine? I don't know if I posted it on TikTok, but if you go to Instagram, I think we posted it about a month ago. So follow me on Instagram. I did a whole talk about it, like what I do and so on and so forth. So go on Instagram, Polly Pocket. It's Dr. Roger Tsai, same name there. Or if you want to click on the link tree above and click on the Instagram page, you'll get to my Instagram page there, and you will see, I think like about a month ago, I talked about my skincare routine. I travel a lot, especially the hot climates. I don't mind my shape and haven't had any issues. I just need implants. I can't complete shop how like I can't feel out the shirts or dress. Yeah, especially if you lost weight or things like that. Sometimes the implants don't fill out, like I said, the chest or clothing as well. So having implants, it doesn't have to be big. A lot of patients are doing small implants now, and it looks amazing. So I think that it'd be a good procedure for you. Again, we can have another chat. If I can do a virtual consultations, by the way. So just like I'm talking to you guys now, we can do virtual consultations, and that will we can chat that way. How do you know if you have fat necrosis? Basically, if you have little lumps in your BBL, that's basically fat necrosis. My mom had double mastectomy 6 months ago. She hates how her looks now, but scared of reconstruction. Well, unfortunately, that's what happens with a double mastectomy. It's not very aesthetically pleasing looking. Reconstruction will help with the appearance of it. So if your mom's worried about the appearance of it, then reconstruction should help. Is it normal for one side to be swollen more than the other at 2 weeks post-op? Yeah, it's going to take at least a month before they even out. Can you do anything for sense men? Not sure what you mean by that. I had a labioplasty 8 days ago. Swelling is out of control. Pain is steady at 7 or 8. Is it normal? Usually not normal. I mean, swelling should not be out of control. I would talk to your doctor to see what's going on. Do you have an infection? Do you have excessive swelling? Kind of what's going on, because that doesn't sound exactly quite right. Obese. What about obese, Mike? Can you do anything for obese men? Gotcha. semaglutide, Ozempic, basically, those are the best things. I mean, diet and exercise is obviously the best. But I also we're all busy, and sometimes genetics won't let us diet and exercise the way we would like. So I would say the next step would be doing those GLP-1s, like you said, your Ozempic, your Mounjaro, those types of things. Would you ever consider opening a location in New York City? Probably not. It's already tough enough for me going from here to Miami. And so if you want to see me on the East Coast, I am in Miami, so you don't have to travel all the way out to LA. But it's going to be hard enough for me to do 3 locations. Like I said, it's already hard enough for me to go from here to Miami. Like, the office, and I'm busy here, I'm busy there. Everybody wants me to be more here full time, or be more full time in Miami. So unfortunately, I don't have the time for that. But so most likely not. So probably when I have none, and I'm 4'11" as I'm adult. So yeah, exactly. You're a smaller person, but again, small implants I think would be good for you. Should lipo be done before or after weight loss? It really doesn't matter, because it's more anytime you deal with surgery, like weight loss before or after, that's more skin. So for example, tummy tuck, breast lifts, facelifts, anything that you have to do a lift on, you want to wait till after you're done with the weight loss. Anything to do with volume, you can do it before or after. It doesn't matter. So that's how I like to break it up. Where did you do your residency? In Texas, UTMB in Texas. What do you recommend for body acne? That I'm not going to be able to help you out with, because that's going to be more of a dermatological question for a dermatologist. How often do you travel between places? Once a month I go to Miami for a week. 3 weeks I'm in LA. I currently have saline implants. Could they last longer than 10 years? Absolutely. I've had patients that have saline implants for 20, 30, 40 years. So absolutely, you can keep it in. Silicone or saline, what is better? I personally prefer silicone because they're more natural looking, more natural appearing. But to each their own. They'll both have their positives and negatives. Yes, I'm getting my tummy tuck in June after my weight loss. Perfect. Congrats and best of luck on that. What do you recommend to have a face like yours for the same age male? I do both. I forgot to mention, I do Botox as well. So I do Botox, skincare. I sleep a lot. I drink a lot of water. I work out 5, 6 days a week. I'm in the sauna 5 or 6 days a week. I do peptides. I do NAD. So that's basically everything I do. And I think genetics helps as well. I'll be honest, and this isn't fully just me. Oh my gosh, where is that college? It's so close. Drexel's in Philadelphia. When do you need to stop Mounjaro before surgery and after? I believe 2 weeks before and 2 weeks after. Was it difficult studying for this profession? Yeah, I was in school till I was 32, 33, something like that. So yeah, your 20s are gone, and the beginning of your 30s are gone as well. I've lost 185 pounds and need full body help. Do you ever do fleur de lis? Absolutely, Tracy Lemove. I do fleur de lis all the time. Click that link above, schedule a consultation with me, or click the link in my profile, and then schedule a consult with me. I'd be happy to chat with you. Nose job, scars inside nostrils. Yes, so I do them closed. Scars are inside the nostrils, no external scars. That's how I do all my rhinoplasty. So yes, I do like the scarless or closed fashion. Is it red? I would love a tummy tuck. Great. Click that link above and schedule a consult with me. Is red light for the whole body good for your health? I think it helps for healing. I know a lot of people do it for their face as well. I haven't heard too much about it for the body. Are the prices the same in Miami or in California, or cheaper in Miami? It's a little bit cheaper in Miami, but depending on where you are, by the time you fly out to LA, the price is going to be the same, I guess, if that makes any sense. By the time you fly to Miami, again, depending on where you are. If you're on the West Coast, it might be cheaper because you don't have to pay for a hotel and all that kind of stuff. Out in Miami, if you're not from there, you might have to pay for a hotel and all that kind of stuff. So it is a little bit cheaper in Miami just because, LA is everything in LA is more expensive. I thought you school in Texas. Oh, I did. Yes. So sorry. I did my residency in Texas. So yes, I did my residency in Texas, in Houston. And very happy. Didn't see the first. You just did my niece's procedure on Monday, and she's recovering well. Oh yeah, great. And she's very happy. Oh, my pleasure. I'm glad she's doing very, very well. I'm happy to see that. Are lymphatic massages necessary for lipo? It's not necessary, but it can help in the short term. Absolutely. Thanks for that, Edwin. Glad to hear she's doing well and she's very happy. Do you recommend lower blephs and festoons with refacing done at the same time? You can, absolutely. Do you do rhinoplasties? I do a ton of rhinoplasties. Yes, click that link above. The link in my profile, the link tree in my profile, and click on my before and after page, and you can see all my results there. Do you prefer under or over the muscle? Under the muscle. Always under the muscle. For the most part, 99% under the muscle. It depends on, there's like 1% of patients that I think is better for above, but 99% is under the muscle. Do you do arm lifts? Absolutely. Yes, I do arm lifts. If you'd like a consultation, click that link in my profile, schedule a consult with me, or send me a direct message and I'd be happy to get you scheduled. I have lost weight and have the marionette lines. Would microface be appropriate? I'm not sure what you mean by microface. You might need more like a facelift type procedure to lift that. Can you recommend a surgeon in New York, please, for a facelift? Oof, I don't know anybody in New York. Actually, I know a guy in New York. Kasir, I think, is in New York. Kasir. I think he's in New York. He does a very good job. I like his results. Loss of loose skin after nursing, but I don't want to lift. Options? There's no options. Loose skin is just like clothing, right? Like if you see the seam right here and the seam right here, if there's too much material, you got to cut it out. Anytime you cut something out, it comes with scars. So there's no way, unfortunately, that you can get a lift without having scars. I have a deviated septum but don't want no surgery. What are the options? Live with it. That's the only other option. The only way to fix a deviated septum is to have a surgery. So if you're not wanting to have surgery, you're just gonna have to live with it. Do you specialize in the tip of the nose? A lot of surgeons can't do this correctly. I think I do a fairly good job at the tip of the nose. Again, if you click on my link tree in my profile and look at my rhinoplasty section, you can see that I have a lot of results for the tip of the nose. So check those out. My wife is triple D and wants to go to G. Is that safe? I mean, beauty is in the eye of the beholder, right? So if she wants to do that, it's up to her. A couple things. Number one, very heavy implants. You're going to sag quicker over time. Number two, that skin's been stretched out so much that it's so thin, you're not going to have the support. So it's probably going to droop and sag much quicker over time than someone who doesn't. So again, all up to you. All right. I desperately need an arm lift. Is it a hard surgery? No, it's not a hard surgery at all. It's fairly easy to do. How do you feel about traveling internationally for surgery? A friend of mine is doing this. There are good surgeons and bad surgeons everywhere in the United States and across the country. The important thing, the thing is, if you throw a rock to hit a surgeon, you're more likely to hit a good surgeon here than not, versus in other countries, because the regulations and the testing and everything that we have to go through here are a lot more stringent than they are in other countries. So that's kind of what I could say about that. Do you do shortening of the sides of the nostril as well? Yeah, nostril reductions? Yes, I do, absolutely. What do you think of PDO threads? I think they're good for the right patients. It's going to be hit or miss because it's non-invasive. But if you're a good candidate for it, amazing. What's an eye skin pinch? Basically, it's more like the upper or the lower eyes. If you have extra skin there, you pinch the extra skin and you cut it out. You're pretty awesome to do this. Thanks for answering questions. My pleasure, Terry. Thank you. Would you recommend Icon Cosmetics in Miami? Never heard of them. I have no idea. Do you do rib removal surgery? Is that safe? I don't do rib removal surgery. In fact, they don't do rib removals anymore. The newest technique out there is to crack them and bring them in. They don't remove them anymore, but you crack them, you break them, and you wear a corset, a tight corset for like 3 or 4 months and let it heal like that. So that's kind of the newer way of doing things. I'm 98 pounds, size A. What's the best size to go with? I want a natural look. It's hard to say. I do sizing with patients. You come in, you try on implants. Maybe high 100s, low 200s. Again, it's hard to say without measuring your chest and seeing what you look like. Thank you, my pleasure. Can you lift your arms to wash your hair after an arm lift? You can. It might be a little bit hard to do for about a week or so, but yeah, you can. Can you talk about Sculptra? I'm getting it tomorrow about after losing 188 pounds. Depends on where you're getting the Sculptra. Sculptra is basically a material that stimulates your body's own collagen. So when you get the Sculptra done in like 2 or 3 days, it's gonna shrink and go away. And you're gonna be like, oh my gosh, what happened? Why did I spend all this money? It's because it's all water and fluid. You're actually basically just injecting the material that's, the filler material that's in there. And over time, your body reacts to that material and it grows its own collagen. So it's nice because it grows your own tissues, but it's also unpredictable because you don't know how much collagen is gonna grow after that. So that's my thoughts on that. Sculpture doesn't last. Yeah, you're 100% correct. It goes away after 4 or 5 years, maybe 3 years, something like that, and you just have to get it redone. If someone with scoliosis wants to take out a rib or two, will it cause any harm? That you're gonna have to talk to more of an orthopedic surgeon about that. I wouldn't be able to tell you much about that. Because I don't do rib removals. I wouldn't recommend it. That's not even something I would recommend. So it's not something I can really chat